Dear listeners of the Public Health Insight Podcast, my name is Will, and before we begin this week's episode, we just wanted to share a new partnership between PHI and the Canadian Global Health Students and Young Professionals Summit. The 7th Annual Global Health Student and Young Professionals Summit will be taking place virtually this October 17th, and this event will be totally free of charge for all participants. If you're interested in learning more about this event, please check out the link in this description below. Additionally, if you're looking to have the opportunity to present a global health project in a conference setting, please fill out the abstract submission form also in the link below by September 20th. Examples of projects that would be appropriate for this poster event include global health-focused projects for school, thesis topics, work, volunteer, and internship projects, and the summit is seeking posters on a broad variety of topics and encourage submissions in any discipline or field related to global health. Thank you so much, and enjoy the episode.
Public health is a population-based field of science focused on preventing disease and promoting health. Every week, we will be engaging in interactive discussions and analyses of the latest public health issues affecting you and your communities all around the world. This is the Public Health Insight Podcast.
My name is Gordon, and I'm here with Ben, LaShawn, Linda, Will, and a special guest who will be introduced later.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
Education is often considered the single most important modifiable social determinant of health. However, access to high-quality education remains a problem at both the secondary and post-secondary institutions for a variety of reasons. An article by Krishni Medivir, titled Envisioning Higher Education as Anti-Racist, outlined some of the disparities for racial and ethnic minorities in higher education and some actions that can be implemented to address some of the historical disadvantages that contribute to the inequities. In this episode, we'll examine the role of education as a social determinant of health, highlight racism in higher education as a barrier to the success of racialized students and graduates, and dissect some of the recommendations that were proposed in the article to narrow the educational divide. To discuss this incredibly important topic, we have invited a special guest. She's a public health advocate, educator, civic leader, and author. She has spent the last 15 years providing tools and strategies to stakeholders, community-based organizations, and residents to improve health and prevent disease in some of Los Angeles County's most underserved communities. She has also spent the last 12 years infusing her lived experience and work experience into her teaching to inspire students to consider public health as a viable career option. She is currently an adjunct professor in the Urban and Environmental Policy Department at Occidental College and has taught at Cal State LA, Ashford University, and the University of Phoenix. In her first book titled Pushing Through, Finding the Light in Every Lesson, she shares both the heartbreaking pain and extraordinary triumphs that led her to advocacy and social justice work. Her story takes place against the background of the long neglected and overlooked community of South Central Los Angeles, where she grapples with the grotesque imbalance of power and privilege as it unfolds in every aspect of her life and those around her. Please welcome to the Public Health Insight Podcast, Amazon best-selling author Nicole Fick.
Welcome. Hey, everybody. Hi, all of you.
Oh.
Hi, Gordon. Hi, Linda. Hi, Will. Hi, Ben.
Hi, Nicole.
Hi, LaShawn. How are you?
Hello.
Oh, you weren't kidding about the names then.
Let me tell you, I have to say this. I want to tell you how important it is to acknowledge and speak. We are teleworking at my current position, and literally every morning I email every single one of my staff, good morning, one by one. And one of them noticed, like, thank you for that. Because I'm like, I got to, it's important to maintain that normalcy when right now, like, nothing is normal. So I'm big on saying good morning and thank you. Thank you is such a huge word for me right now, and good morning. So
Right.
Well, thank you.
Amen to that.
Well, thank you. Exactly.
Yeah, thank you.
We're going to get into, the relationship with education and population health. So I'll start by saying an American philosopher, John Dewey, once said that education is not preparation for life. Education is life itself. And we know that public health is concerned with preventing premature mortality. And we think it's important to discuss whether there is a definite link between educational attainment and premature death, whether it's life expectancy or quality of life in general.
Awesome. Well, I am an educator, right? So I teach, and I've been teaching for quite a number of years, and I've also been educated, right? So I've also gone through school. And the funny thing is that, yes, education and public health are these two things that go hand in hand. And for me, one of the things that is most disheartening is to see, especially now with COVID-19, the divide, right? The disparities that we see in the quality of education that certain people get and certain people don't. And I can even reflect back on my own education and the type of wonderful instructors that I had growing up and how that prepared me for the life that I have today. And it really feels bad to know that there are children today in the country that says we will pay for and guarantee all children an education, but it's not the same across the board. And in essence, it means that we're setting up a certain population, and let's be honest and real about what that population looks like. We're setting them up for failure.
That's a good point too, because you can say, okay, education is important, but there are people that are very successful, whether white or black, who maybe didn't even graduate high school, right? But the reality is, when we talk about public health, we're looking at things at the population level, and which is why I emphasize population, because when you look at the numbers, it's clear that there is some link with education and, even life expectancy. So for example, in a study I was reading, it's shown that, life expectancy, after you get to the age of 25, is strongly associated with the level of education that you have. And, people with less than a high school education at the population level are often worse off. So I'm glad that you pointed that out.
Absolutely.
And then to expand on that a little bit further, there's something called the education gap, or the life expectancy gap due to education. And essentially what it's found that between the most educated and the least educated people in America specifically, it ranges from between 14 years for males and 10 years amongst females. So it does show that while there are other factors, education determines income, genetics, and other social determinants of health, such as housing, are important for our quality of life and the ability that we have to live longer lives, we can see that education is very important.
Absolutely. One of the things that I teach my students in my introductory public health course at Occidental is that, yes, more education typically leads to better income, more control over your life, be able to live where you want to live, pick a good school district for your children. You have more control over your destiny. But we often don't think about the other impacts that educational attainment has on people's lives and therefore their health. So we learn health education in schools. We learn how to eat. We learn how to create networks and create friends. And those types of things also have a huge role. And I think we often don't talk enough about some of those other benefits that education brings. And we go straight to, well, if you go to school, you'll graduate, get a good job, and that's the end. And that really isn't sort of the only way or reason that education is really important.
That's a great point too. And even I think the ability to ask questions and to think critically, that's something that gets emphasized through school. And now with COVID and all the misinformation out there, I think that having that skill of thinking critically and asking yourself, where does this information come from? That's proving to be, like, not to exaggerate, but it can be life or death in a situation like COVID. So.
Absolutely. And I am working in public health and seeing how people are reacting to the virus. Some of us are following instructions, wearing the mask, staying inside, and to see people just really push so hard against some of the most basic science and information has really been, I can't even really put a word to it, but I'm really disappointed. But I think for me, because I have the background I have, I'm like, where did we go wrong in the educational system? I'm not going to blame that individual. Where did we go wrong where this person doesn't really understand that this is not a in some senses, it is a political thing, but at the end of the day, like, we're literally trying to keep you from dying. Can you please put the mask on? No, we're not, taking away your freedom. You can still breathe through the thing. But so I always say, why doesn't our population understand basic science? Where have we failed in the educational system? Because it sounds like this is not just a few people. There's a lot of people that have a lack of understanding of some of those key, really foundational premises and concepts. That's really kind of frightening to me.
Yeah, that's a good point, because I was doing, I think in one of our previous episodes, I think our climate change episode, we're talking about the reasons people believe in certain things. And there was one researcher that said in her research, she found that your political ideology became the number one determinant of your belief system, and it surpassed education as a number one determinant of your beliefs.
Wow.
So I think that goes into the whole point with COVID-19 being so politicized. It's like, if you are of a certain political cloak, or if you belong to a certain political party, you're more inclined to believe one thing over the other, despite your education levels.
Wow.
Yeah. So that's an interesting thing that we probably have to dedicate a whole episode to.
Yes.
Yeah.
I agree.
But on that point that you were making, that beyond the kind of immediate things of, education's good because you get a nice degree and people think you're smart, right? You have but you have real kind of health indicators, like the infant mortality rate, where, people, I didn't even know this till I was looking at some readings yesterday, that infant mortality rate is closely associated to the level of the education that the mother has for that has a child. And then that child, depending on the parents or the mother's education levels, obviously they're not going to be able to, if they have lower paying jobs, they're not going to be able to afford and provide for the child in a way other parents are able to provide for their children.
Yes, that data has been mind-blowing. And then when you lay a race over that data, whole different story. Black women with college degrees have infant mortality rates as high or higher than a white woman with a high school diploma. So if we talk about education being a protective factor, the more education you have, the healthier you are. Why isn't that true for Black women? And I talk about that in the book that I wrote. Like, why you tell us to go to school so that we can be smarter and get the good job, but also to be healthier overall. But why isn't that education protecting Black women? And I've heard stats that say Black women are very degreed. We have lots of years of education, and it's still not saving us. So when you layer race over it, it becomes a whole different story. And all of the things we know to be true, in a sense, seem to go out of the window.
Right. And I think even I would say, from what I've read also, Black women, very qualified, educated Black women get paid less compared to pretty much every counterpart for the same work.
Yep.
So that's another astonishing thing that we have to look into.
Yep.
We started talking about looking deeper beyond the surface of, education is great because, you can brag to your friends about how smart you are. But let's kind of talk about some of those mechanisms through which education can influence those very health outcomes that we're discussing.
Right. So I think the one that I like the most, because of my background in health education, that's where I started in public health 15 years ago, way back in the day, is this idea.
And you're a certified health education specialist.
Yes, I am. Yes. I spent 10 years doing community level work. And so presentations, really literally teaching people how to live better lives, adopting some of the behaviors that we try to help people do, eat better and all that great stuff. So that one thing that, again, that's kind of in my wheelhouse is health knowledge, health literacy, problem solving, which I think Linda talked about, like being able to critically think. And so the other part of that is the information about diet, exercise, smoking, teaching people to wear condoms when they have sex. So sex ed would fall into that. And so that's sort of that very basic level aspect of the impact of educational attainment on health. So if you can get a child from kindergarten all the way through high school, talk to them about their bodies, help them learn how to solve problems, teach them to read and understand health information and health knowledge, then we will likely have a healthier population at the end of the day. Now, we know there are some school districts, some people are not in public schools, they're in private schools. They don't even get things like sex ed. And so I have had students in my class at Occidental College, these are college students, say to me, we did not get sex education. Okay, so how, where'd the lesson come about condom? Like, nobody talked to you about a condom or negotiating?
It's like you have so many questions when you hear something like that, right?
I'm like, what? What happened here? So it's really important. I think that is really, really important for a lot of the things that we're seeing now, again, with the COVID issues. Like, why are we're sending out messages and information and documents, and folks don't necessarily have the literacy skills, regular literacy skills or health literacy skills to be able to decipher what's true and what's false. And so that causes a lot of issues, for example, for sure.
I just want to kind of take a bit of a tangent. It's related to what you were saying, Nicole, regarding health literacy and health education and everything like that. But I think part of the role of, the various agencies or organizations who are disseminating that information, I think they as well have a role in making sure that, for example, with the current COVID pandemic, whatever information that is being sent out and provided for the community is at a level that's, easier to understand. Because I find a lot of times with health information is that organizations tend to like to, try to be innovative and make up a bunch of new acronyms or, throw in a lot of technical language, technical jargon that oftentimes we as public health professionals might not even be too familiar with them. So I think it's definitely, I see it as a twofold, both educating the population and the community, but also keeping, the information providers accountable for what they're providing out there.
Yeah, you're right, Will. One of the things that we do where I work, and specifically in the office that I lead, I'm a program director, we uphold the department's plain language standards. So when they want to put something out, it's like, wait, let's look at this. This word has too many syllables. Wait, does this make sense? Because again, if especially in an emergency like COVID, or if there's a wildfire, which we get a lot of in Southern California, or an earthquake, people are already stressed. They're already worried, anxious, scared. So that also even brings their reading levels down even more, right? Remember the last time you were in a car accident or a dog was coming for you, how high level was your thinking at that point? It wasn't very high. Right. So we also have to remember, we have to bring it down even further because people, we want them to get the information and more importantly, to act on it. So wear the mask. And this is what you need to do. Real simple. We're actually getting more into infographics using pictures, because we also have to remember that, especially in a diverse county like Los Angeles, there are some people that don't speak English or Spanish. There are some people that can't read at all, that can't read any language. So pictures often have to come into play. But you're absolutely right. There is a responsibility for the organizations to make sure that information is easy to understand. And sometimes it's like, even for me, I'm like, what are you trying to tell? What? So I have to kind of ask, like, okay, what does this say? And we often have to push back just in general terms with need to know versus want to know. What do they need to know versus what you want them to know? And those are two different things, right? A physician might want to put everything in there. Wait, no. They really only need to know 1, 2, 3. That's it. And so we have to make sure that happens. But you're absolutely right.
One of the interesting things that I found regarding how education influences health outcomes was a study that was done that showed that some sort of relationship between formal education and learning opportunities outside institutions influence the likelihood of forming relationships and forming social networks. And those that have higher education tend to have larger social networks, which then goes by showing that you can increase your access to financial, psychological, and emotional resources that eventually could protect you from harmful effects of stress, and have that that coping strategy and form those coping strategies.
Right. I talk to my students about that a lot too, being able to pivot. You get a flat tire. And for someone that is low income or has a hard time, that can be devastating, ruin the whole day, ruin the whole week. They don't have money. But for someone that has a larger social network, hey, either they can pull their credit card out, not a big deal, figure out ways to move on. And so that
call a neighbor.
Yeah, right. Or oops, let me just go get my other car. It's okay. And that's the reality, that ability to be able to cope and manage when something kind of, that little wrench gets thrown into your life. That really does make a difference. It can be devastating for certain people that don't have that access to those resources. And for some people, it's just a minor inconvenience. And we've all experienced how that feels to be totally, I had a car accident. My car was gone for 2 months. Wow. And I'm like, what's going, what? And I had to take the bus and, start walking and doing things that I didn't normally do. I had to rearrange how I moved on weekends. I'm going to one place and run one errand. And that's it, because I only had, trying to get on the bus to go everywhere was too much, and Uber was too expensive. So just imagine someone trying to navigate. And it makes a huge difference.
I had an experience I wanted to share, and I'm interested in your perspective on it, Nicole, because Will brought up a great point regarding plain language and health literacy in regards to misinformation in the whole COVID epidemic, and how education for the public, we would hope that a higher level of education would make them have more informed health decisions. But recently I got into contact with one of these hugs over masks, or basically these fake exemption cards as to why individuals don't wear masks. And what I found really striking about it was on the back, they provided these scientific, in air quotes, details of why you should not wear a mask. And I'm going to share a bit of it just really quickly, because I just want you to pay attention to the language and how we can see, like, if an individual is not educated in the scientific method or just in healthcare in general, how this is a very convincing argument. So, for example, increases virus risk. It encourages triggering an infection from dormant retroviruses already in the body, taking advantage of a weakened immune system due to mask wearing. Wearing a mask shuts down the immune system. It decreases oxygen intake, increases carbon dioxide as toxin intake, puts down the body, and makes it under stress, therefore shutting down the immune system and increasing cortisol. So we see that they're using a lot of scientific language. A
lot of jargon. Yeah.
Exactly. So if you were not, educated and you saw this, you'd be like, this seems believable.
Yeah,
right?
they sound like they know what they're talking about.
Right. And it can be really scary because people will be like, no, this is what this says. This has to be true. And the counter argument is, like, doctors and nurses wear masks all day, doing surgery and doing other things. They're fine, right? I've never seen a doctor fall out in the middle of a surgery. And they wear them all the time. And so I think that's the other side of it too. Like, how are we making sure that we're, that's the other part, I think, is trying to counteract those types of messages, right? Because like you said, they sound so official. How do we say, well, this is how you look for or can tell that something is not true? I think that's the other thing. There's so much misinformation, and it's so hard to counteract it. Even if, say that was in our county, and in our county people put something out to say, this is why this isn't true. It's too late, because the other one already been out for like a week and is sharing it with everybody. And, nobody follows the county health department Facebook pages in any county, I'm sure, except the people that work there. But so the other stuff gets spread around. And I'll give you an example of that too. There was a fraudulent letter that went out. Someone somehow got a hold of a letter from one of our county health agency, and forged or something and modified the letter. And it was all weird. The logos were wrong. For me, I'm like, this obviously is a fake letter, obviously for me. But I saw people on my Facebook, my friends, sharing it. Oh my goodness, look at this. And I'm like, you guys, this isn't a real letter. But I mean, how would you know? And it's already been, shared a trillion times. So even by the time someone says, hey, sends out an official notice, it's too late.
On the damage,
Right. We got people calling residents, acting like they're contact interviewers, and they're not, asking for personal information, financial information, trying to scam people. Wow. And I know that's not just where I am. God. I'm sure all over the country, people are trying to take advantage. And so it's hard. And then you get people that don't want to give you information. because they're not sure you're the person you say you are. It's such a mess.
And I find that even what makes it more of a mess is that from public health, obviously our goal is to educate, but because people don't have the understanding of the scientific method, especially when it comes to a pandemic, is that, information is always evolving.
Yes.
There's trust that is lost every time we have to update our information. Therefore, people seek out new sources. So we kind of lose that educational foundation of trust that we have in order to help inform people.
Yeah.
And I feel like it's just a double-edged sword there.
Absolutely. I think the other part of that, the other side of that as well, and I've said this before, is that some of our entities, public health or otherwise, don't necessarily have a strong relationship with community.
Right.
And if they did, sometimes that, it would be easier for people. Oh, yeah, I know that, my cousin works for public health, or, oh, yeah, I remember because that lady came that day to our organization and she works for public health. So obviously this information has to be true. There's not that connection. And the only time we make those connections is usually when there's an emergency like COVID, or there's a fire, or there's something. But otherwise, we're not as engaged, I think. And that's just my personal opinion. And I'm sure other public health workers would agree that, there is a lot and it's kind of hard to do, but we could probably do a better job so that when stuff does happen, we can tap into those connections that we've made and say, can you help us spread the word about the accuracy and when, what we're doing, the data, the work that's happening, so people can understand what's going on. I think that's something that overall system-wide, public health system-wide, we need to work on.
Right.
For sure.
Absolutely. Because I know definitely before this pandemic, people asked, what's public health?
Yep.
And you're kind of like, we make sure that everything runs well in the background.
Yep.
Okay, cool. After the pandemic, everyone knows what public health is.
Yep. And don't worry, in about 5 years, what's public health? It'll go back. It goes in cycles,
Don't forget. Yep.
Are those guys who told us to wear those masks? Oh.
I hate them.
Yeah, so I think those are some really good points, because when we talk about education, we're talking about formal education within educational institutions, as well as kind of the street education or learning outside of the education system. And both of these are important when we talk about things like, chronic diseases such as heart disease, diabetes, which disproportionately affect people who have lower levels of educational attainment. And one study in the United States talked about how the prevalence of diabetes in adults without a high school education was double that of those who have completed college.
Wow.
So you could see there's real effects on. We don't know exactly what the mechanisms are for those. Are the eating habits different? Do they live in neighborhoods where they can exercise and food deserts? And I'm sure there's a lot of factors behind that it's not such a easy relationship to kind of tease out.
Right.
But it just goes to show that whatever the mechanism is, education always pops up as something that's very important, whether it's formal or informal education.
Absolutely. Absolutely. And I just worry and think again about all of these children, two things that are in these urban school districts across the country that are in schools that are underfunded, teachers are under-resourced, and they get the short end of the stick anyway. And now in some places schools are closed. And so now you again have created a situation where there will be some children that will do fine. Their parents will hire a tutor, or they'll create these learning pods and they'll be okay. But there are going to be these kids that will fall so far behind. And what plans are there to make sure that these children are able to catch up, right? And ultimately, we're thinking about, well, they'll probably be a grade behind or a grade and a half behind. We should worry about that as far as getting them to graduate. But I'm looking at what are we talking about 20 or 30 years from now for this child's life when they're an adult and trying to, work and what type of health issues will they have? So it's just a really disheartening situation.
Yeah, I've seen that pop up in the news lately with parents coming together to get private tutors for a group of kids. And it's on the surface, it's yes, the parents doing kind of everything they can to get their children the best education they need, especially considering the disruptions caused by the pandemic. Yep. Mm-hmm. But on the other hand, as a public health professional, you always have to look at equity. So what does this mean for kids who aren't in that position to get those benefits?
Right.
What does it mean for kids who don't have reliable access to internet, don't have a laptop, don't have a computer, who have to stay home another semester to get educated from home, and their parents maybe can't. Maybe it's those single parent households where the mom or the dad can't really stay home with the children, right? To kind of help them. So it's bigger than just the individual level where as a parent you do everything you want for the child. You have to look at the population level and how COVID-19 is going to exacerbate some of the disparities that already exist.
Yep,
right?
it's very unfortunate.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.